Your spinal column consists of 33 vertebrae that are stacked together and can be divided into 5 sections. There are 4 coccygeal, 5 sacral, 5 lumbar, 12 thoracic, and 7 cervical vertebrae. These vertebrae provide stability for your torso and also serve as protection for your spinal cord and the origins of smaller nerves that branch out to various parts of your body. The vertebrae are connected to one another by strong bands of tissue called ligaments, and to the surrounding muscles by tendons. An injury called whiplash, which affects the 7 cervical vertebrae of the neck, is most commonly caused by car accidents in which the force of a blow from the rear causes the head to whip backward and forward very swiftly. This action can cause tears in the muscles, tendons, or ligaments of the neck. It can also cause a nerve to be pinched between 2 vertebrae, resulting in pain or numbness that may radiate down to the shoulder, arm, and hand. Depending on the severity of the injury, whiplash may be treated with a range of interventions, including immobilization with a neck brace, anti-inflammatory medication, exercises, and, in extreme circumstances, surgery. Your spine is made up of 24 bones or vertebrae, which support and protect your upper body and spinal cord. Injury to the spine, like a herniated disc, an abnormal curvature of the spine, or an unstable spine caused by illness, may require a skeletal fusion to reduce pain and increase flexibility. During a skeletal fusion, small pieces of the hip bone are implanted between the injured vertebrae. Those small pieces of bone will combine or fuse with existing vertebrae to create one single solid bone. Until the bones fuse together, the spinal column should be kept from moving, so a metal rod is sometimes used to keep the spine in place. An external cast or brace can also be used for additional support. After a skeletal fusion, it's important to follow up with physical therapy. Don't attempt to lift anything over 10 pounds, squat down, or twist your body until your spine is completely healed. Our skeletal system is the framework for our body. It gives us our shape, protects our organs, and allows us to move. Movement is accomplished by an interaction of the bones with muscles, ligaments, and tendons. However, sudden injuries or repeated physical stress can damage the tendons that attach our muscles to our bones. For example, one common injury affects a tendon that anchors the extensor carpi radialis muscles of the lower arm to the outside bump or epicondyle of the elbow. Because this muscle is used to pull the hand backwards, as in a backhanded tennis swing, the injury is often called tennis elbow. The repetitive movements required during tennis, as well as painting and many other tasks, put stress on this tendon, causing small tears to form. Inflammation or tendinitis then ensues. Treatment of tennis elbow often involves rest and anti-inflammatory medications. A brace may also be beneficial primarily because it forces you to reduce the use of the elbow. Your backbone consists of a series of vertebrae, or small bones, which are separated and cushioned by discs. The discs are filled with a jelly-like substance and act as shock absorbers between each vertebrae. Nestled inside your vertebrae is the spinal cord, which sends out small nerves that branch out to your arms, legs, and other parts of your body. Trauma or injury to the back can cause the discs to rupture or protrude and press on the nerve coming from the spinal cord. Pressure on the nerve can be painful, and because those nerves most likely travel to other parts of your body, you can feel pain, tingling, or numbness in other areas as well. Treatment of a ruptured disc can range from bed rest to surgery, depending on the severity of your back injury. Many people think that our bones don't change, when in fact the center of our bones are the primary source for red blood cell production. In a normal healthy bone, remodeling occurs when osteoclasts eat away part of our bone tissue, and osteoblasts come in and refill part of that hole with new material. People with osteoporosis experience a decrease in bone mass, which means that the osteoclasts are eating more of the bone than is being replaced by the osteoblast. Our bones become less dense and are more susceptible to breakage. In fact, fractures that occur with very little stress are the primary result of osteoporosis. Here's how healthy joints work. Let's take the knee for example. The knee is made up of 4 bones. The 2 primary bones we're interested in are the femur and the tibia. In a normal knee joint, the surface of both bones is covered with cartilage. Cartilage is a smooth, strong, resilient material that cushions the impact between the femur and the tibia. The joint is surrounded by a fluid which aids in joint mobility. In people with arthritis, what we see is a degenerative loss of cartilage resulting in bone exposure, bone destruction, and inflammation of the fluid around the joint. We use the knee to help explain this condition, but osteoarthritis is certainly not confined to the knee joint. It is commonly found in the neck, back, and hip. The knee joint is mainly comprised of bones and supporting ligaments. The femur or thigh bone, the tibia or shin, and the patella or kneecap are surrounded by cartilage and ligaments that support the knee joint and work to protect it from injury. The medial meniscus is a C-shaped cartilage that is attached to the tibia and acts as a shock absorber for the knee. The medial meniscus can be torn due to twisting the knee violently or by the normal process of aging. In either case, the result of a torn medial meniscus is pain and swelling in the knee and the inability to straighten your leg normally. Repair to the medial meniscus typically involves surgery. The torn portion of the cartilage is removed and smoothed out during a procedure called a meniscectomy. After surgery, physical therapy will be recommended so that you will regain your strength and flexibility in your knee. Our skeletal system is made up of over 200 bones that support our body weight and protect our organs. The knee joint supports a large amount of weight and, over time, can suffer structural damage. The knee is made up of 3 main bones: the patella or kneecap, the femur, the bone in your thigh, and the tibia or shin bone. Normal aging or knee injury might require you to have a knee replacement surgery. In either case, the cartilage that covers these surfaces has become worn down, making walking or other movements painful. During a knee replacement surgery, the lower part of the femur and upper part of the tibia are removed and replaced with metal pieces that are identical to the injured joint. In some cases, the backside of the patella is also removed. Knee replacement surgery will most likely reduce localized pain and swelling and allow those suffering with knee pain greater freedom and mobility. The skeletal system provides the framework for your body. Your hip joint supports most of your upper body weight, but as you get older, your bones become thinner and more brittle and can leave you vulnerable to injury. The hip joint is located in the pelvis, which is actually made up of 3 bones: the pubis, the ischium, and the ilium. Together they form a socket or acetabulum for the head of your femur, the long bone that supports your thigh. During hip replacement surgery, the top of the femur is removed and a metal implant is put in its place. The socket is hollowed out as well, and a new socket is put into the bone. Adults over the age of 60 and an increasing number of athletes are prime candidates for hip replacement surgery. The carpal tunnel is a tight, narrow passageway in the wrist that is made up of tiny bones that form the letter C and the ligaments that lay across the top. Some of the tendons and nerves that control our fingers pass through the carpal tunnel into the hand. These tendons are covered with a fluid-filled sheath which helps them glide smoothly. During repetitive hand motion, like typing, the tendons become injured and this causes swelling or inflammation within the sheath. Because the carpal tunnel is made of bones and ligaments, it can't expand to accommodate the swelling. So when the sheath expands, it pinches or compresses the nerve, which causes pain or numbness in your fingers. The anterior cruciate ligament, or ACL, is located in the center of the knee. The ACL works with the PCL, or posterior cruciate ligament, to prevent your knee from moving too far forward or backward. The ligaments wrap tightly around the femur and the tibia to form a crisscross pattern. Injury to the ACL is usually sports-related. A torn, stretched, or ruptured ACL can be the result of injury or repetitive physical stress, like excessive pivoting or twisting of the knee. Usually, an ACL tear will cause swelling, stiffness, and pain. Many times, a noticeable popping noise can be heard at the time the injury occurs.